Hello, my name's Heather Kennett and I'm a registered nurse and I specialise in diabetes education and wellbeing. And I have a lot of people who say, well, what does a diabetes educator do? Or why do I need to see a diabetes educator? And I guess a lot of times when I see my patients for the first time, they're a little bit shell-shocked and the doctor said, oh, you've got diabetes, you need to see this and this person and we'll see you in a month. Here's some medication. And so it's a really challenging time for people when they are first diagnosed, and they really are very lost and are a little bit concerned as to what do I eat or what am I supposed to do to manage this. And so a diabetes educator is somebody who can actually pull all the pieces together and educate you in terms of how to live well and manage your diabetes, so you can live a really happy, healthy life. So my first thing with talking to people about diabetes is that sometimes it's a blessing in disguise, because you start to feel so much better than you've felt for a long time, and there are so many things that or it's taken a long time to get diagnosed or to even realise that you've got it, that you just assume or expect that you're getting old or you're just not feeling so great. So as an educator, my role is to help you I guess to start off with, know exactly what diabetes is, and there are many forms of diabetes, what your risk factors are, what the signs and symptoms of diabetes are, and then what do we do and how can we manage it. So there's a lot of people actually involved in looking after you when you have diabetes. So there are obviously the doctor initially who will diagnose and let you know that you have diabetes. Then there's a diabetes educator, a dietitian, podiatrist. You've got a ophthalmologist if you need to for looking at your eyes. We've also got people, psychologists who can help you look after, managing the everyday mental health side of a chronic illness. You've got your endocrinologist, who's a doctor who's specialised in looking after people with diabetes, and there's exercise physiologists who can help you with your activity, and there are numerous other little areas or professions that can also help you as well. So for my role, I feel like it's a very much holistic view. So I want to know who you are as a person and what makes you tick and where you're at, because I don't believe we're all the same and we're all different. We've all got different ways of doing things, and it's a matter of working together as a partnership to work out what works for you. So coming to an educator, we're not going to tell you what to do. We're going to work with you to help you manage what's relevant to you. So we can do a variety of different things. We can look at, well, particularly with food, get you on the right track with healthy food, and also particularly why we eat certain foods, or the mindfulness related to eating. And a lot of that comes or can come down to emotions and stress. So looking at those sorts of things. We look at stress management and what's happening in your life that causes you to do certain things which affect your diabetes. We look at things like, we educate you about your eye health, dental health, about your hearing, about what quality of sleep that you're getting. We do your blood pressure and check and make sure that we've got the blood pressure within a safe range. We look at your cholesterol results and your HbA1c result, which is a term that you'll get to know quite well, which is your 3-monthly review that we can use to see how things are progressing. We can teach you about blood glucose monitoring, what particular meter would suit you and why you're monitoring, what patterns you're looking for, and making it meaningful. We also help you with getting started with the Freestyle Libre or any other device that is a monitor that can give you really important, relevant, amazing information as to over a 24-hour period or a 2-week period as to what's happening day and night, and that's a really useful tool to work with you with. And in terms of the different, there are subspecialities. You've got gestational diabetes, where women who have diabetes during pregnancy have specialists that can look after them. We have people with type 1 on insulin pumps, and there are specialist people that help you manage that. So there are certain professions, like I was saying earlier, that we can refer you on to help you manage your particular diabetes, and there are different people who you know are more beneficial than others in terms of where you're at. So it's all about you. It's about what you need and what we all can do together to help you to keep healthy and to prevent the diabetes complications that we all talk about and we're really passionate about preventing. So I'm very passionate about making things simple, about making it so that you can do just basic simple things that will enhance your well-being, because sometimes we get overloaded and we get bombarded with so much information that we go, oh, forget it, we're just not going to do anything, and so we don't. And we just leave it, and nothing improves. So in a nutshell, we're all here to help you, but as a diabetes educator, we're here to sort of put all the pieces together, you know, look at any issues you might have, or look at your skin, or look at your feet, and, you know, give you some advice as to who next to see. So we're really excited and we're really passionate about looking after you and caring for you and nurturing you through this period, and just like I said earlier, helping you to live the best and the healthiest life possible, because that's what we're all really aiming for. So I'd love to see you, or if you've got any questions, please, you know, see a doctor or see a diabetes educator or your other health professionals, because we're all there willing and ready to help you.